Thank you, Cancórla Minister. I have two issues. First of all is about carers employed by the HSE, those carers who are literally running around the country 30 minutes in one house, perhaps getting somebody up, getting them dressed, breakfast, out the door, off to another house, etc. It's cut to the bone and it's care on speed. Now, Minister, those carers are being asked to don PPE, take it off, put on face masks, hand hygiene, etc. It's extra time before they go in, when they come out, how do they discard it, etc. And all I'm asking is that some extra time would be provided for those workers, not a diminution of services, but that little bit of extra time that will allow them to give quality care. My second issue is about the new document published by the HSE, the framework for the resumption of adult disability day services. Minister, I think we'll all accept that family carers of adults with disabilities were abandoned from March 16th. I'm not apportioning blame, but we recognise people were left basically locked in their own homes, and we have to ensure that doesn't happen again. Now, Minister, if I were a parent of a person with disabilities and I read this document, which I have, I would be absolutely devastated. As one carer said to me less than 2 hours ago, everything we fought for over the last 30 years is disappearing in front of our eyes. Up front, this document tells us, and I quote, "The resumption of services will result in service users receiving a reduced quantum of service supports," and they describe this as the new normality. And they go on to say that the reduction in the quantum of service will lead to greater reliance on service users, families and carers. In simple language, they're saying, we are cutting back frontline services. It will fall back on families. Get used to it. Now, Minister, this is in direct contradiction to what's in the programme for government, and I'll just give you a quote. On page 79, under Day Services and Supports, it says, "We will commit to expand adult day services and supports," and it goes on, "we will deliver increased home support and personal assistance hours." Has anybody told the HSE about this? Has anybody told the HSE that their plan contradicts another commitment in the programme for government, the implementation of the UN CRPD, the United Nations Convention on the Rights of Persons with Disabilities, where under loads of articles, but just pick one, Article 24, the rights of persons with disabilities to education at all levels and lifelong learning. So my question is, if schools and creches can reopen, why not day centres for people with disabilities? And if our shopping centres and hotels and pubs can reopen, why cannot day centres for people with disabilities? And, you know, I'm not saying that this is simple. It's not. If the HSE had said resumption of services will be somewhat reduced at the start, but we will use all means at our disposal to increase day services, if they had consulted with family carers before they announced their decision, and incidentally, that's another commitment in the programme for government on page 78, if they had done that, then there'd be the inclusive approach that they speak of in their document. But they didn't. And they also say, and I quote again, "The government plan for reopening the country sets out phases which indicate a very gradual loosening of restrictions over the coming months." Well, that isn't factually correct, Minister. We started out with 5 phases, we now have 4, we're in 2+. The third is June 29th and the fourth is June 20th. So part of the basis for their decision is factually flawed. I know I've taken up most of the time. I don't normally do this, but I feel so strongly, so I have 2 asks. Oh, just before that, this document speaks about the use of technology, Zoom video. What about those who don't have access to the internet? What about those who have who are non-verbal, who have language disability, those who have a visual disability, those whose attention span will not allow them to participate, who take one look at the screen and walk away. And as one carer said to me, what about the nitty-gritty, everyday challenges that parents face around toileting and what we euphemistically call challenging behaviours? So can I ask that it is explicitly stated that this is not the new normal, but a temporary adjustment until the levels of services can be reinstated and expanded as promised, and that it's time-framed. And secondly, that the extra supports that carers need will be put in place at the same time as services are reduced, and not after carers begging for them forever. I'd appreciate a written answer, and thank you.
Thank you very much. I'm sure the Minister will correspond with you.
Could I just, I'm conscious we're in time, but I'm just conscious it's such an important issue Deputy Harkin's raised, and I will correspond with you in detail. But I think the way Deputy Harkin has outlined the issue is exactly how this should be viewed. This is a starting point to get these services back up and running. These people and their families have been left largely on their own due to this pandemic. We need to get the services back up and running. Not all day centres are the same, and nor are all service users the same. So there shouldn't be a crude one document that fits all, and it will require engagement, and I will make sure there is real meaningful engagement with the associations and with people directly with disabilities.
Very